Okay. Now, dito naman tayo sa ejaculatory ducts. Now, the ejaculatory ducts are small but crucial passageways yan where sperm and seminal fluid mix before being expelled. So, tingnan natin yung structure niyan. Each ejaculatory duct is about 2 centimeter or around 1 inch long. No? They are formed by the union of two structures. Number one would be the duct from the seminal vesicle, and number two would be the ampulla of the ductus deferens. No? Kapag location naman, it is above the base of the prostate where the seminal vesicles connect to the ductus deferens. No, these ducts travel inferiorly or downward and anteriorly forward through the prostate. Ang main role ng ejaculatory duct is to deliver sperm and seminal vesicle secretions to the prostate or prostatic urethra. Now, yung fluids na to may eject into the prostatic urethra right before the release of semen. Yun yung final step before the semen moves through the urethra out of the body during ejaculation. Now, ang urethra kasi, dual purpose yan, no? Meron yang, it serves both the urinary and reproductive system. So, unique siya. So, ang male urethra kasi 20 cm or around 8 inches long, and it passes through several key regions of the body. Magsa-start yan sa bladder, magpapas yan sa prostate, and runs through the deep muscles of the perineum, magko-continue na yan sa penis. So, tingnan natin yung parts ng urethra. It is divided into three. Meron tayong prostatic urethra, intermediate membranous urethra, and spongy penile urethra. Ang prostatic urethra, yan yung first part ng urethra. About 2 to 3 cm or 1 inch long. It passes through the prostate gland where seminal fluid is added to the sperm. Site din yan where the ejaculatory ducts empty their contents. The second part would be the intermediate or membranous urethra, which is about 1 centimeter or 0.5 inches long. No, it passes through the deep muscles of the perineum. And lastly, we have the spongy or the penile urethra, which is the longest portion measuring about 15 to 20 centimeters or approximately 6 to 8 inches long. It runs through corpus spongiosum and ends at the external urethral orifice. Okay. Again, meron siyang dual function, meron siyang urinary function, and meron din siyang reproductive function. Now, during ejaculation, yung same urethra na yan, mag-expel yan ng semen, which contains your sperm from the testes and the fluids coming from the seminal vesicle and your prostate. So, tingnan natin, anong nangyayari during ejaculation or when ejaculation occurs. Number one would be, let's see the semen movement. Ang sperm kasi na na-store sa epididymis, matatransport yan through the ductus deferens and into the ejaculatory ducts. No? And the seminal vesicles then will secrete fluids that mix the sperm. Now, the sperm and the seminal fluid will enter the prostatic urethra, and then they will move through the intermediate urethra and finally the spongy urethra. Now, yung fluid na yun may expel from the body through the external urethral orifice during ejaculation. Now, tingnan natin yung seminal vesicles. No? Anatomy muna tayo. Ang seminal vesicles kasi ay paired, meaning dalawa. No? One located on each side of the male body. Now, each seminal vesicle around 5 cm or 2 inches long. No? Shape yan na parang convoluted pouch. May mga twisted tubule. Ang location yan posterior to the base of the urinary bladder, anterior to the rectum. Now, each seminal vesicle merong duct that joins the ampulla of the ductus deferens. Now, yung union na yun, nagfo-form ng ejaculatory duct which then empties into the prostatic urethra. Now, let's take a look at the function of seminal vesicles. Ang seminal vesicles kasi, crucial yan sa production of seminal fluid, which makes up about 60% ng total volume ng semen. So, tingnan natin kung ano yung mga important substances na mayroon dito sa seminal fluid. Number one would be alkaline fluid. No, ang sinesecrete kasi na fluid ng seminal vesicle, alkaline or basic in pH. Tumutulong yun to neutralize the acidic environment of the male urethra and the female reproductive tract because both of which are hostile to sperm. No, kapag acidic kasing environment, that can damage the sperm. So, yung alkaline nature ng seminal fluid tumutulong to protect them and ensure na they remain viable. Ano pa? Number 2 would be fructose. Ang fructose kasi type of sugar yan na nakikita rin sa seminal fluid. No, nagpo-provide yan ng sperm by being converted to ATP. Kasi nga, ang sperm, kailangan niya ng maraming energy to swim through the female reproductive tract para ma-reach niya yung egg for fertilization. Number 3 would be prostaglandins. Ang prostaglandins kasi, hormone-like compounds yan na merong role sa sperm function, no? Ini-stimulate niya kasi yung smooth muscle contraction sa female reproductive tract para mas mabilis or makatulong ma-propel yung sperm toward the egg, no? Nafa-facilitate yung movement ng sperm through the cervix and into the uterus. Meron ding clotting proteins. No? Ang seminal vesicle kasi nagsasecrete din ng clotting proteins to help the semen coagulate after ejaculation, no? Para ma-prevent daw yung sperm from leaking out of the vagina after ejaculation. Para nandun lang sila, tumaas yung chance of successful fertilization. However, later on, magre-liquefy din yung semen para makapag-swim ng mas maayos yung sperm to move toward the egg. Next one, we have here prostate. No? Ang prostate kasi single yan, parang donut-shaped gland, about the size of a golf ball. Nandyan sa tortora yung size ng prostate. Now, it is located inferior or below the urinary bladder, and it also surrounds the prostatic urethra. So, yung prostate kasi, magbibigin yung growth niyan, no, from birth to puberty, gradual lang. Pero from puberty to around age 30, mabilisan na yan. Mas rapid ang growth. However, after 30, mas stabilize na yung growth niyan. Pero pag around age 45, possible na lumaki ulit yung prostate, mag-lead sa condition known as BPH or benign prostatic hyperplasia. Dito, possible na mag-press on siya sa urethra, hindi makaihi yung patient natin kasi nga meron ng urinary issues. No? Napapress on si urethra. So, tingnan natin ngayon yung function ng prostate. Ang prostate kasi nagpo-produce yan ng milky, slightly acidic fluid. Essential sa sperm. Isa na dyan would be your citric acid. Citric acid ay napoproduce ng prostate fluid na merong role din sa ATP production. Meron ding proteolytic enzymes, kagaya ng PSA or prostate-specific antigen. Meron ding other enzymes. By the way, yung PSA, yun yung nagbe-breakdown ng clotting proteins na produce or sinecrete ng seminal vesicles para maliquefy yung semen after coagulation, allowing sperm to swim freely. May mga other enzymes din kagaya ng pepsinogen, lysozyme, amylase, and hyaluronidase. So, aside from enzymes, meron ding acid phosphatase. No? Aside sa acid phosphatase, meron din si seminal plasmin na merong antibiotic properties. So, tumutulong yan to destroy the bacteria para ma-make sure natin na hindi mamamatay, hindi madadamage yung sperm because of infection. Para viable pa din ang semen. Ang sperm cells. Next one would be the bulbourethral glands, also known as your Cowper's glands. No, ano yung size and shape niyan? Small pea-sized gland, no, roughly the size of a pea. Location would be inferior or below the prostate. No, it sits on either side of the membranous urethra. No, and the glands are embedded in the deep muscles of the perineum. Yung ducts nila nag-open into the spongy urethra. So, ano yung main role ng bulbourethral gland? Ang main role niyan is to secrete fluids that protects and prepare the urethra and sperm for ejaculation. So, number 1 there would be, before that pala, ang before ejaculation kasi, yung male urethra may acidic residues from the urine. Yung acids na yun, pwedeng ma-damage or yung ma-kill yung sperm cell. Now, yung urethral gland, magsisecrete yan ng alkaline urine into the urethra para ma-neutralize yung acidic residues, para ma-make sure natin na hindi expose yung sperm cell sa harmful acidic condition. So, meron ding lubrication. No? Yung glands kasi, na to, magsasecrete niya ng mucus para mag-act as a lubricant sa may tip ng penis para bumaba ang friction, no, ma-facilitate yung smooth passage ng sperm during ejaculation. Of course, para maprotektahan yung mga sperm kasi smoother na yung path. And sometimes, yung bulbourethral glands kasi nagsisecrete niya ng small amounts of clear mucus-like fluid during sexual arousal. Yun yung tinatawag natin na pre-ejaculate or pre-cum. Yung pre-ejaculate or pre-cum, wala yung sperm cell. Pero ang purpose niya is to prepare the urethra for the passage of sperm during ejaculation. Now, dito tayo sa semen. No? Saan ba gawa ang semen? Actually, it is a combination of sperm cell and seminal fluid. So, ano yung mga structure kung saan ba galing yung semen? Number one would be seminiferous tubule. Doon talaga nagagawa ang sperm cell. Number two would be seminal vesicle. Again, yan yung gland na nagsasecrete ng fluid that makes up to 60% ng semen. Alkaline yung fluid na yan para matulungan man-neutralize yung acidic environment of the male urethra and the female reproductive tract. Meron din yung fructose para sa sugar, energy. Number 3 would be prostate gland. It contributes about 25% of the semen. Nagsisecrete yan ng milky, slightly acidic due to citric acid and proteolytic enzymes. So, sila yung nagbe-breakdown ng protein sa semen para mas mobile sila. And lastly, we have here bulbourethral glands. No? Yan yung nagsisecrete ng small amounts of mucus. So, gaano ba karami yung semen na napoproduce? In a typical ejaculation, 2.5 to 5 ml ang volume of semen na napoproduce. Each ml, merong 50 to 150 million sperm. So, kapag bumaba ang sperm count, sa example, below 20 ml per 20 million per ml, possible na mag-indicate na yun ng infertility. However, alam naman natin na number ng sperm is crucial, pero important din na merong enough seminal fluid to help the sperm swim effectively. Kasi kapag kunwari, masyadong maraming sperm, pero hindi naman enough yung seminal fluid, magkukos pa din yan ng infertility. Kasi nga, yung sperm tails pwede magtangle, hindi na sila makakagalaw efficiently. Now, ang pH ng semen ay slightly alkaline, 7.2 to 7.7. Despite the slightly acidic nature ng prostatic fluid, yung seminal vesicle kasi yung nagko-contribute ng mas maraming fluid. Kaya, generally, alkaline ang pH ng semen. So, tingnan natin yung consistency ng semen. Diba, milky appearance siya because of prostatic fluid. Sticky ang consistency niyan because of seminal vesicle and bulbourethral gland. Paano naman nagbe-behave yung semen after ejaculation? So, meron tayong 2 steps. Number 1 would be coagulation. Kasi within 5 minutes of ejaculation, yung semen kasi mag-coagulate or mag-thicken. This is due to the presence of clotting proteins na meron sa seminal vesicle. And then, after 10 to 20 minutes, magkakaroon na ng liquefaction, meaning magli-liquefy yung semen because of the enzymes like PSA na pininoduce ni prostate and of course other enzymes as well. Yun yung nagbe-breakdown kasi ng clot to allow the sperm to start swimming freely. Paano naman ngayon kung delayed or hindi nangyari yung liquefaction? Ibig sabihin nun, immobilize na yung sperm. Hindi na siya makakapass through the cervix, hindi na niya ma-reach yung egg. No? So, for example, yung sperm nakapasok na siya sa uterine tube, mag-undergo yan ng process called capacitation. Now, during capacitation, yung sperm's membrane magiging more fluid. No? Mas ma-efficient na sila sa pag-swim. Essential yun for fertilization para ma-penetrate ng mas maayos yung secondary oocyte or yung egg for fertilization. Lastly, would be your penis. Meron niyang 3 parts, generally, blood, glans, penis, and root. Yung body, yun yung cylindrical shaft na nag-extend outward. Yung glans, penis naman yun yung rounded tip or yung head. It is often compared to an acorn in shape and more sensitive due to the concentration of nerve endings. Andiyan din yung root, part of the penis that is attached to the body and connects to the pelvic area. Kindly read on corpora cavernosa and corpus spongiosum. Pag-usapan natin yung erection mechanism, which is a key during sexual activity. Now, ang erection kasi, this is a physiological response sa sexual arousal, and this is controlled by parasympathetic nervous system, which is a part of your autonomic nervous system, yung nagkokontrol ng involuntary body functions. So, paano ba yung nag-work? Magsa-start yan with the stimulus. Kapag ang brain kasi naka-receive ng sexual stimuli, kagaya ng touch or visual cues, magsasend yan ng signal through the spinal cord to the penis. This is when your body starts preparing for sexual activity. Meron ding NO release or nitric oxide release. So kapag yung signals na yun na-reach yung penis, yung parasympathetic nerves magre-release ng molecule called your nitric oxide. No? Yun yung nag-relax ng smooth muscles sa walls ng blood vessels para sa supply ng blood sa penis. And then number 3, blood flow. Again, nagkakaroon kasi ng relaxation. Ibig sabihin nun, more blood will flow into the corpora cavernosa. No? Mag-feel ngayon, or if you feel nun, yung erectile muscle causing the penis to become firm. Now, this increase in blood flow compresses the veins that normally drain the blood from the penis. Kaya natatrap yung blood inside na may maintain yung erection. And lastly, may mechanical stimulation. Kasi physical stimulation also plays a role in maintaining the erection. May mga specialized receptors kasi sa skin ng penis called mechanoreceptors. Sila yung nagsasend ng signal to the spinal cord na nag-a-amplify ng arousal response. Okay, now pag-usapan natin ang ejaculation. Pag sinabi natin ejaculation kasi, yun yung release of semen through the urethra to the exterior. Reflex action yon na coordinated by sympathetic nervous system. Yun yung responsible for the fight or flight response. So, let's start with emission. During sexual arousal kasi, yung sperm from the testes, pag-move through the epididymis and vas deferens and is mixed with fluids from the seminal vesicles, prostate glands, bulbourethral glands para mag-form ng semen. Now, yung semen, mag-enter yan sa urethra. No, yung muscles naman around the base of the penis magko-contract, pushing the semen out through the urethra in a powerful expulsion. Now, during ejaculation, yung sphincter muscle sa base ng urinary bladder magko-close, magko-contract para mapigilan natin yung urine na ma-release during sexual activity. Okay, now pag-usapan natin yung mga issues, no, mga concerns or mga medical conditions. Number 1 would be priapism. Sometimes, an erection doesn't go away even when the sexual stimulation stops. Ang tawag sa condition na yun ay priapism. No, ang priapism masakit, persistent kasi yung erection that can last for several hours without arousal. And possible na cause yun ng iba't ibang factors kagaya ng medication, blood disorder, damage to nerves, etc. No, medical condition to, dapat dalhin ka agad sa ER para matreat, para maiwasan ang tissue damage sa penis. Meron ding premature ejaculation. No, pag sinabi natin premature ejaculation kasi masyado mabilis yung ejaculation. No, before or right after or shortly after yung penetration, meron na kaagad ejaculation. And this can cause distress and is often related to physiological or psychological factors kagaya ng anxiety, stress, no, or even overly sensitive glands, penis, or foreskin. Now, in many cases, ang premature ejaculation kasi pwede yung matreat with therapy, behavioral techniques, mga medication. Some methods include squeezing the penis during arousal para ma-delay yung ejaculation or pwedeng uminom ng specific medication para makontrol yung reflex. No? Now, pag-usapan natin anong circumcision. Ang circumcision kasi, surgical removal yan ng foreskin. Typically, performed in infancy or childhood for cultural, religious, or medical reasons. Yung iba naniniwala na ang circumcision may medical benefits, including reduced risk of UTI, penile cancer, sa certain STIs kagaya ng HIV. However, ang medical community kasi medyo divided pa yan on whether the circumcision is necessary from a health perspective. However, may mga studies na kasi, especially from certain African regions, na bumaba daw ang rates of HIV infection sa circumcised men. However, this is still a subject, no, of ongoing research and debate.